And I call the member for Warringah.
Thank you, Deputy Speaker. This is an important motion because we are all concerned about the mental health, especially of our young people. There are 4 key asks that I feel are important when we talk about Headspace. I think it is important that we make Headspace exempt from telehealth requirement to have an initial face-to-face consultation. We need a national scheme for real-time data collection on suicide in general and youth suicide in particular. And we need a coordinated sector approach, bringing together health, departments of community and justice, educational and local service providers. And finally, support programs that provide prevention and resilience. Deputy Speaker, I thank the member for Bass for providing us with the opportunity to speak on this important issue of youth mental health and suicide prevention. I'd like to take the opportunity to thank all the healthcare professionals who are working in this space, and for that I acknowledge the work of larger groups like Headspace, Lifeline, Reach Out, Sane Australia and Beyond Blue, but also the smaller local groups in my electorate of Warringah like Heart on My Sleeve, Gotcha for Life, the Raise Foundation, Catholic Care and the Community Northern Beaches. These professionals are on the front lines. They're saving lives, but they need our support. Then there's no denying that COVID-19 pandemic has hit our youth extremely hard, and they are feeling the stress and anxiety of that burden. The figures are sobering. The latest study to come out of the Brain and Mind Centre at Sydney University predicts that over the next 5 years, the prolonged economic impact of COVID-19 will result in a 30% increase in the number of suicides by 15 to 24-year-olds. 30%. As a mother of teenagers, these statistics terrify me. As a lawmaker, they challenge me. What can we be doing better in this place to catch those kids before they fall through the cracks? In the short time I have this evening, there's a couple of things I think we should focus on. The first is to make Headspace exempt from telehealth requirement to have that initial face-to-face consultation. Our local Headspace provider in Brookvale, workers have reported a dramatic increase in demand. But it's not just the numbers that have increased, but the severity of the cases that are presenting. Dr. Gilda Brunello, who works there, says that there has been a shift from cases being mild to moderate to now being severe. And in talking to Dr. Brunello, she's also raised with me a significant problem created by the recent changes to telehealth, whereby doctors are now required to have had a physical consultation with their patient in the last 12 months. Prior to this change, they were able to access a patient remotely and develop a mental health care plan via telehealth. So the requirement of the face-to-face not only creates a very real health risk for the patient, the doctor and support staff, but may lead to delay in desperate kids getting an initial assessment that they require. I also call on the Minister to consider making Headspace services exempt from the requirement of that physical face-to-face consultation. We need a national scheme for real-time data collection on suicide in general and youth suicide in particular. There's a lag of sometimes 12 to 24 months between reporting of suicides in Australia. It makes it incredibly hard for healthcare workers to identify and react in real time to local issues that may be contributing to suicide rates. I was pleased to see last week that New South Wales Mental Health Minister, Bronnie Taylor, announced that they will fast-track their suicide register and have it up and running by October in New South Wales. This will allow police, health, justice agencies to access virtual real-time data on suicides to better target support services. Thirdly, we need that coordinated sector approach, bringing together Department of Health, Education, Community and Justice along with local services providers. And finally, it's vitally important to support programs that provide prevention and resilience, not just focus on crisis care. Gotcha for Life is one such organisation that operates in Warringah, and they say that it is so vital to be able to be engaged with youth in the schools. We also have a program, Mitch Wallace from Heart on My Sleeve. He says connection and supportive relationship is the #1 resilience factor associated with cultivating and protecting positive emotional well-being. So with that in mind, I want to end tonight by reminding all of us, but particularly our kids, that it's okay to not be okay. It's okay to be broken and to ask for help. And please, if you're struggling, ask for help.